Hi friends, so this is Dr. Ravi Kamapalli, infectious disease and wound care physician in Lima, Ohio, presenting you a case of a patient with a coccyx ulcer that had been complicated by fall and initiated after a fall and hospitalization because of confusion. She presented to the hospital in November 4th, 2017, 3 days prior to which she fell down and essentially had been detected to be confused and thought to be having UTI as a presenting symptom, but detected to have uh, an ulcer that was present on the coccyx area. If you see, here is the ulcer that has been noted in the coccyx region, and a significant area of induration and ecchymosis that was noted. And initially this was seen, and she ended up being evaluated and admitted to the hospital. A patient was noted to have an ulcer under it, so we just decided to uh, take off the surface devitalized tissue, and we were starting to manage this with the kissing buttock ulcer dressing that we do. Please see the case 3 that we presented earlier regarding the technique that we use for with rolled gauze that is applied to this site. And essentially the middle portion still did not look completely gone, but essentially there was still what appeared to be a devitalized tissue, and we were hoping to salvage that area if possible. But over the next 2 days, she was closely monitored. But as you see, with antibiotic therapy that was started with Unison, given that patient had methicillin-sensitive Staph aureus infection, and given that induration and all, she ended up having improvement, but more organization of the purulence that was noted here. And so decision was made to continue to closely take care of her problem and debride the wound bed. And this was done in an excisional manner, wherein we removed the devitalized tissue after a local anesthesia, and this was done at the bedside, and we pushed out a little bit of devitalized tissue from the left gluteal area and debrided it, and ended up then on the next day noticing some hematoma present here, and that was removed, and we started application of wound vac. But after a few days, we did notice that the wound vac was also causing trouble, and she clinically has gotten better by now, and we decided to transfer her to the transitional care unit. And problem in the transitional care unit, when we were trying to get the wound vac in place, was still the vac was not able to be kept at place, and there was leakage, and application of the vac, and because of anatomic reasons was not possible to keep the vac in place. So we decided to go ahead and do a debridement again, remove the devitalized tissue, and instead of doing the vac, wound vac, we decided to just start packing the wound with antimicrobial gauze, and also started using the rolled gauze Kamapalli technique that is in case 3. Please see that. And we applied it and frequently changed the dressing packing 3 times a day, and that helped the tissue to become more granular, as you're seeing here. And then we decided to go ahead and then delayed secondarily close the wound area with mattress sutures, and brought the coccyx area ulcer together. And as you see, there's not much induration around this area. And once this was done, we continued with application of the rolled gauze to separate the gluteal fold that was keeping the area adherent, to keep the separation of the gluteal fold. And this was continued, and patient was discharged home, and with partially sutures and staples removed, and we left 3 sutures in place. And by the time she came to the office on 12/20/2017, she ended up completely healing off, and we just had to take off the 2 stitches, and she went on to heal well. Please see the patient's perspective video that in approaching this healing process. And thank you very much. Hi, Dorothy.
Why, hello there, Dr. Kamabali.
How are you today?
Oh, well, it's nice meeting you.
Okay, so today is December 20th, 2017, and thank you, Betty, for bringing her for this appointment.
You're welcome.
So, Dorothy, tell me what happened to you? What made you come to the hospital? And tell me a little bit about you and how your problem with your soul started.
Can you give him a little bit more?
Okay. She had fallen,
Uh-huh.
and then when she could not get herself up, and her tailbone had been hurting her.
Okay.
And it had been hurting her for about 3 or 4 days.
Okay.
And she had scooted across the carpet to get to a call light in her assisted living facility she lives at. And then I saw her the next day, and her tailbone was really hurting her. So we said, okay. So on Saturday morning, she seemed a little off, like she wasn't herself.
Mm-hmm.
She kept falling asleep while I was talking to her. So I said, I want to take you to the ER. Something's not right.
Yeah.
And so we took her to the hospital.
And then when she came to the hospital, we found that you have a little bit of urine infection, but the real problem was the sore in the back. And so immediately when I saw it, we went ahead and cleaned it up and started antibiotics. So tell me, Dorothy, what did you, what was going on with your thought process? Like, were you worried, or what was your?
My thoughts on this?
Yeah.
Well, they were all telling me what a good doctor you were.
Oh, really? They were
Yes.
lying, huh?
and you know, I put my hands a lot in God,
Okay.
and I figured that you were going to take care of it.
Okay.
And I had no qualms about it.
Okay.
Now there were a couple times that you did your procedure, and it wasn't what I'd say.
Pleasant.
It wasn't pleasant, but it wasn't uncomfortable.
Okay.
You made it so nice because you froze it,
Yeah.
and things like this. You made it really comfortable for me.
Yeah. Basically, what we did was we injected some numbing medication and cleaned it out, and then took off the dead stuff from there, and then we did the local wound care. So, and basically, what was your questions and thoughts as to what was going on with her, dear? As a family member, what were you worried about?
I was actually worried about it first. When I first brought her into the ER, I was worried about maybe a brain bleed or something because she had fallen. And she was confused. So it didn't dawn on me. So we had the CAT scan, we had all this stuff done, and I showed them the wound on the back, and they're like, oh, it looks like there's a scab on it. Everything's okay. But then they came back with her white blood cell count, and it was 30,000. And they said, oh, something's not right, you know. And her tailbone had been hurting her for a couple days. So I thought she had bruised it when she fell.
What were your initial questions as to how long it's going to heal?
Oh, I thought it was going to take a long time.
Yeah.
When you opened that up, it was big. I was like, it was like a cave in there. It was like, oh my goodness. I thought it would take months and months to heal.
Yeah.
That was my first thought.
So she fell down on the 4th. She was admitted on November 4th. She was admitted to the hospital, and then we cleaned it up. And then, what were your questions regarding going to the transitional care unit we have?
We were very grateful that you
were
pushed
happy
for
with the
that.
services at
Oh
transitional
my
care
goodness,
unit?
yes. They did such a nice job.
I just got a letter from St. Rita's,
Yeah.
and it was 5 pages long.
Wow.
And I had to fill it out and say what I thought of St. Rita's.
Wow.
Was it good?
Okay.
Very good, blah, blah.
Yeah.
But on the other hand, I put everything good except 2 things.
Uh-huh.
And 2 things I put very good.
Uh-huh.
I had a very good doctor.
Okay.
and I had very good service.
Yeah.
Care.
I'm happy that you felt that way. And basically what we do is try to figure out what are the barriers to your problems and try to understand what's going on with you and slowly try to remove them so that your body does what it's supposed to do, the God-given potential that you have to heal. So I'm happy that you had a good outcome. We took off I left 2 or 3 sutures in there just because I wanted to make sure that the wound does not dehisce open. So we closed it on 11/27, and then I think on 12/9 she went home, and 12/20 she's coming in for a follow-up.
Yes.
And we took off the sutures and it's all healed.
All the sutures are gone.
All the sutures are gone.
We're very grateful how proactive you were also.
So good.
So.
Thank you, my dear. Thank you for coming, and Merry Christmas and a Happy New Year to you. Okay.
Merry Christmas
Thank
and a
you.
blessed New Year to
Thank
you.
you.